CDC's former chief medical officer says Health and Human Services Secretary Robert F. Kennedy Jr.'s drastic policy changes pushed the agency into, quote, pure chaos. Dr. Debra Houry resigned in protest last summer. In a wide-ranging interview with Face the Nation moderator Margaret Brennan, she spoke about her concerns.
I think the secretary has caused a lot of irreparable harm. And when you look at many of the polls out there, the trust in public health, specifically CDC, has decreased dramatically, over 20 points in many polls. That's really difficult to recover from. And when states are removing links to the CDC website and following other medical organizations, I don't know how you build back that trust overnight.
CBS News medical correspondent Dr. Celine Gounder is here with us now. She's also the editor-at-large for public health at KFF Health News, and she's read the CDC emails Congress just released. Dr. Gounder, good morning. Welcome. That's a stunning claim there, 20% reduction in trust from people from an agency meant to help people. What else did Dr. Houry say?
So Dr. Houry also said that essentially immediately the CDC stopped running on science. She said that people, political appointees with no medical background, no scientific background, were overruling career scientists at the CDC. She was never allowed to brief Secretary Kennedy, so to provide him with information to help with decision making. That's normal standard operating procedure, and that the layoffs at the CDC gutted the agency. So she ended up resigning because she couldn't actually do her job, and she kept the emails as proof of how decisions were being made during that time.
Now, one detail you mentioned is that she said the new secretary, when he took over, stopped running on science. Let's just listen to that specific sound.
We started getting executive orders where we took down hundreds of websites, and I thought this is highly unusual. You know, science doesn't change based on who is in office. And so when these things were happening, I knew this is different than before. I also didn't brief the secretary, which was very different than prior administrations.
Now, she did release her emails and these exchanges. What initially alarmed her?
The takedown of flu shot ads. So the day after the secretary was sworn in, his office ordered the CDC to pull these flu shot ads. They'd already been produced, already paid for, and we were in the middle of a very bad flu season, the deadliest flu season for children outside of a pandemic, flu pandemic. And the agency's own communications chief in writing said that this carried significant legal risk and reputational risk. They pulled the ads anyway.
This is concerning to hear. The doctor also spoke about the measles outbreak. Here's what she said about messaging from the secretary at the time.
We needed people to respond during a measles outbreak and get vaccinated if they weren't. Instead, he talked about healers and treatments around like steroids and antibiotics and even vitamin A. We actually saw vitamin A toxicity cases in hospitals. People were taking too much vitamin A because there had been messaging that it was helpful for measles.
And there are more measles details that didn't even make it to air for time. What can you tell us?
So during the worst measles outbreak in the last 25 years, a Kennedy aide asked Dr. Houry for 15 years of case data, so old data, every child, every condition they had. And there's context to this. The same week, the Children's Health Defense, so this is the anti-vaccine group that Kennedy used to lead, they had claimed that one of the children who had died from measles in this current outbreak hadn't really died of measles. And they were trying to pull this data to try to back up that claim. And the reason she pushed back was not because she was afraid of what the data would show, but rather you're in the middle of a big outbreak. You've had all of these folks laid off at the CDC, and this would have taken people away from responding to that active outbreak. And she said, look, the outbreak comes first.
This is really eye-opening details. Viewers can see the interview that aired on Face the Nation on our website. Dr. Gounder, thank you.